Well, today, February 29th, is Rare Disease Day, a day that raises awareness for the 300 million people who have challenges that many of us don't know about or even understand. We're joined by Dr. Efrat LaMandre, or Dr. E, with some tips to navigate your treatment and medical options. Dr. E, thank you for being with us this morning.
It's a pleasure.
So, of course, millions of people suffer from these diseases. Help us understand, what is a rare disease?
A rare disease is classified, as its name suggests, that not too many people have it. It affects about 5% of the population, which seems small, but when you translate it, it's about 300 million lives. About 70% of them are genetic, but that means that 30% of them are from our environment, the things that we're exposed to. So it's really important that we pay attention to it, even though they're classified as rare.
Yeah, they're classified as rare, but a lot of people are dealing with the effects of it. So we're talking about rare diseases, but are there any common symptoms that would be concerning or that would make you think you have a rare disease?
There is not a common symptom because they're so varied, but there is a common journey. First of all, in the beginning of your journey, in the beginning of the disease, your symptoms might be vague, very hard to explain. People may not take you seriously, which brings you to the second universal part of the journey, which is you're not going to be believed for a really long time, and you're probably going to have to go from provider to provider until you get your answers.
Oh, that is so frustrating. I think that's why it's so important that you hear medical experts say trust your gut and learn to advocate for yourself when seeking medical care, because on the first few visits they may tell you, oh, nothing's wrong, because they just don't know enough about it.
That's exactly right. Trusting your gut is the most important piece of advice I could tell someone who thinks they're going through something, because you know your body better than anyone else. And you're going to be doubted. Your family might doubt you, your providers might doubt you, and don't let that become a self-doubt for yourself. Trust your gut and keep going until you get the answers you deserve.
Oh, I'm glad you're giving this advice, because that is a tough journey, and it will make people feel isolated and alone, especially when the disease is considered rare, because they also may not know many other people who suffer with it. So even though they're rare, how do you fight that isolation?
So I want to let you know you're not alone in two ways. You're not alone in that you're being dismissed, and that I just want you to know, don't take that personally. It's because people are not aware. So you're not alone there. It's not against you. It's kind of what happens from a lack of awareness. But you're also not alone because there are a lot of patients and providers who hear you and see you. So keep going.
All right, Dr. E, this is absolutely nothing we want to see anyone go through, but thank you so much for joining us with that information. That will certainly help a lot of folks.
A pleasure.
And you can find more information about Dr. E and Rare Disease Day by going to KCALnews.com and clicking Seen on TV.